And then in the medical component, we can look at things like you just talked about, Dr. McIntosh, whether it's allergies, congestion, enlarged nasal turbinates, enlarged tonsils, enlarged adenoids, tongue tie, lip tie, things like that can contribute to how the muscles of the mouth work and function. And then in the dental skeletal system, we look at the shape of the mouth and the hard tissue. So how are the jaws aligned? How is the palate? Is the shape wide or is it narrow and high vaulted? Are the teeth crowded because the jaws aren't large enough? And before I have Dr. Harrell explain that aspect, I just want to say the role of the oral facial muscles in how our airway grows and develops. So we need to have our tongue and lips resting in the correct position from birth, if not during fetal development, which is kind of crazy because they see babies who have a tongue tie when the baby's born. Oftentimes, that tongue is already low from resting low in utero, and the baby's born with a narrow gutter palate and oftentimes a more protruded lower jaw. So there's contributing factors genetically that happen really early, even before birth. But what we need is that tongue resting correctly up on the palate, up on the roof of the mouth with gentle suction away from the teeth, but pressing gently on the palate to help the palate grow wide and forward to its genetic potential. So the tongue is like a natural palatal expander, and the lips are like braces for the teeth. And that closed lip posture helps that person obtain correct balance of the oral and facial muscles. And that tongue up helps counterbalance the pressure of the cheek muscles on the teeth at the sides. And we have patients who might be open mouth breathers, or they might just rest with their tongue low or forward or pushing on their teeth. And when that occurs, the pressure from our cheeks, just normally just resting on our teeth on the sides, is no longer counterbalanced by the tongue, and the roof of the mouth can narrow. And the roof of the mouth is the same bone as the floor of the nose. So as the roof of the mouth or the palate narrows, there becomes less space in the nose to breathe, and allergies and inflammation will have more of a significant impact. The septum can bend and deviate because there's less space, and there's this whole cascade of issues that many times can begin with some of these soft tissue problems or tongue and lip problems.